Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common condition we treat in our office is tension headaches. So tension headaches are usually caused by tight muscles in the base of the neck, and then when those muscles become tight, it can restrict the motion in your joints in your neck, and then that can cause the headaches. So in our office, there are 3 ways we treat tension headaches, and in this video, I'm going to show you how we do that. The first way we treat tension headaches is we use a technique called dry needling. So with dry needling, we're going to place a couple small, tiny acupuncture needles into those tight muscles at the base of the neck, called the suboccipitals. And what that's going to do, it's going to take pressure off of the joints and help to reset that muscle and relax it. That is going to help calm down the headache and also take the pressure off of the joint. We're going to place the acupuncture needle into that suboccipital, and there's 4 main muscles that we're going to kind of treat in that area. This is a really quick treatment. Once we put the needles in, they don't have to be left in that long, and then we take them out. But what we're going to do is we're going to kind of focus on any of those muscles that are really tight. Then we're also going to treat some of the muscles in the neck that go vertically from the mid-back all the way up to the neck, because that can contribute to some of that compression in the neck. The other muscle we want to treat with dry needling is called the levator scapulae, and that muscle attaches on the corner of your shoulder blade and then comes up and attaches onto the neck. And so from poor posture and tension and stress in your upper back, this muscle will often get tight and can also contribute to the headaches. So we're going to treat the attachment site of the levator scapulae right where it attaches to the scapula, right here. Good. And then we're going to treat this side right there. Great. And that is how we perform dry needling for tension headaches. So that's it for the dry needling. So we're going to take out these needles, and then we're going to do a couple other techniques to help release some of the muscle tension and to loosen up the joints. So the next treatment we're going to do for tension headaches is a technique called active release technique. So the difference with this technique is it's going to stretch the muscle and it's going to help take that pressure off of the joints. But with this, we're going to incorporate some active motion as we're stretching it. So what we're going to do, we're going to target those same muscles we just treated with dry needling. We're going to contact the muscle, and then we're going to rotate the head. Good. And then we're going to come back, treat it again. Good. And to show you over here, we're going to contact that muscle, and then we're going to rotate. So a lot of times when patients are really tight up here, they'll have some limited range of motion, turning their head left and right, or that can trigger a headache. And so this is going to help with that. So that's one muscle. The other muscle we're going to treat is here, and this one goes more vertical. Good. And these muscles are very difficult to stretch. I'm going to show you a couple ways to stretch this out, but it's a very difficult muscle to try to get in there and to release some of that tension. Perfect. So the second way we're going to treat tension headaches is with active release technique. The third treatment we're going to do for tension headaches is a chiropractic adjustment. So what will happen again when those muscles get really tight, it's going to put a lot of pressure on the joints and restrict some of the mobility and the motion in the joint. So this is going to help to restore that mobility and that motion and also take pressure off the nerves in that area. So what we're going to do is we're going to position our head a little rotated my way. Good. Perfect. And what that's going to do, it's restoring that motion right at that joint. And we're going to do this side as well. Great. So chiropractic adjustment is the third way we're going to treat tension headaches. To treat tension headaches, we also like to have the patient perform a couple different exercises which will help take stress off the muscles and joints in the neck. So the one stretch we want to do is called a chin tuck. So what we're going to do is we're going to have the patient put her fingers on her chin. What we're going to do is she's going to assist her chin, and she's going to kind of gently push her chin back towards her spine. So she's going to retract. Good. And what she is feeling is a stretch in the suboccipital muscles. And she wants to hold that for 10 to 15 seconds and then relax. And then let's do that again. Perfect. And again, I can feel the muscles stretching right in the back of her neck and that's the way you know you're doing the correct stretch. Many times the patients will do this incorrectly and their head may go more back, or they may try to actually drop their chin down. And what we want is, again, more of a just translation back towards her spine. So go ahead and push that back for me. Good, and then again, hold that for 10 to 15 seconds, and you can relax. You can perform this throughout the day or anytime it's feeling really tight or you feel like a headache is coming on, and that's a great stretch. The next important portion to treating tension headaches is going to be posture. With all of us working on computers from home, the thing that I'm seeing a lot in the office is that poor posture. So what will happen is when we slouch all day long, that puts those muscles in the base of your neck under a lot of stress. And so getting into a correct position will help to relieve that pressure on your neck there. So let's have you slouch really bad for me. So when she's in that position, you can feel these muscles here, which we treated with the dry needling, get really tight. And again, they attach at the base of the neck and all along through the spine. So what we want to do is, again, we want to work on her posture. So we want to bring that in a neutral position, and what that does is it automatically releases and relaxes these muscles here, and then it'll also put the suboccipitals in a good position to relax as well. So posture is going to be the second big key to treating tension headaches. To show you from a different angle here, let's have you slouch really bad, and when she does that, again, these muscles here get really tense and tight, and then that puts a lot of stress on the neck and those suboccipital muscles. So what I want you to picture when you're sitting in your chair is, imagine like my fingers are in the mid to low back here, and I want you to try to bring your spine away from my fingers. And when she does that you can see that arch change in her back, but you can also feel these muscles relax up here and take pressure off the suboccipital muscles. So if you're suffering from tension headaches, give our office a call at 703-912-7822, or you can schedule online at novacarewellness.com.